$3.2 trillion. With the amount the US spends on healthcare, you could pay off all the student loan debt, credit card debt, and the federal budget deficit. And even though America spends so much, a 2014 survey found the US healthcare system to be the most expensive and worst performing in terms of health access, efficiency, and equity. It's so bad that a 2013 survey of 17 high-income countries showed that the United States had the highest or near highest prevalence of obesity, car accidents, infant mortality, heart and lung disease, sexually transmitted infections, adolescent pregnancies, injuries, and homicides. Another measure of performance is life expectancy. According to the CIA World Factbook, the United States is ranked 42nd with an average life expectancy of 79.8 years. To put that in perspective, even though American healthcare per capita is more than twice as much as Japan's, life expectancy is about 4 years less. That's like paying for an expensive suit, but there's a giant hole in it. But it gets worse. Costs are expected to keep rising, partially due to expanded coverage under the Affordable Care Act, an aging population, and healthcare cost inflation. And that's not even to mention the 28 million Americans that are uninsured. So obviously, healthcare is extremely complicated and there's no perfect solution. But let's take some time to examine some ideas for tackling these huge problems.
Compromise on this?
I'll sit down with anybody to talk about anything that matters as long as I think I got a chance to deliver. That it works. But what I'm not going to do is continue the same old crap and tell you everything is fine. The biggest winner on Obamacare is insurance companies, not patients, and I intend to change that.
Whoa, we're gonna. Whoa.
I
like that.
All right, good.
All right.
But I'm not
Why do we end up spending twice as much per capita on healthcare as any other country? And Lindsay is right. This system is designed to make billions of dollars in profits for the insurance industry.
We wanted to show the previous clip not to bash Obamacare or the insurance industry, but to show that parties on both sides of the issues agree that our current system is flawed and that there may be hope that they can work together to find a solution. As talks of systematic reform grow louder, one thought is to move toward a single-payer system in which the government covers all healthcare costs. Bernie Sanders has proposed Medicare for All, a plan that will provide universal care by reconstructing our tax systems. The plan's motives stem from the fact that millions of Americans are still uninsured today, but it is also believed that this system could promote economic and entrepreneurial growth. The idea is that more families would switch jobs or form a startup company if the financial burden of healthcare costs were eliminated. This, of course, sounds wonderful. We would love it if everyone in the US was insured, but how would we do it? Sanders suggests that it can be done via tax reform and that it will cost $6 trillion less than the current system if set up his way. Although you can see that tax rates would increase significantly, the plan suggests it would save the average middle-class family over $5,000 per year and the average employer $9,000 per employee each year. If all this sounds too good to be true, well, that's because it might be. Bernie's plan has been met with a little skepticism. John Houlihan and others performed a study for the Urban Institute and found that Bernie's tax reform would raise $15.3 trillion between 2017 and 2026, while national health expenditures increase by $6.6 trillion. 15 minus 6 equals 9, so that's a good thing, right? No, because the tax reform would have to cover total expenditures, which are expected to grow $32 trillion over that same period. Beyond who is right and who is wrong in their estimates, Medicare for All welcomes other concerns. Some fear that the quality of services provided may decrease. To provide an example, let's take a look at Canada, a country who offers universal health care. Many believe it has a better system in place than the US, and it is hard to argue that it is run more smoothly and simplistically than the Affordable Care Act, but the average wait time for treatment in 2012 was 13.3 weeks, and to quote the Journal of Academy of Medical Sciences of Bosnia, the average waiting time in more than 80% of the procedures is 1/3 longer than the Canadian physicians consider clinically reasonable. No system is perfect, and ensuring everyone will likely come at a cost.
On the other side of the spectrum is a bill proposed by Senators Lindsey Graham and Bill Cassidy. It is called the Graham-Cassidy Healthcare Bill, and it is a big change from the current Affordable Care Act, and even further from the Medicare for All proposal. The main concern they had with our current healthcare system is that it increases our expenditure and puts too many regulations on the states. With this bill, they aim to cut healthcare spending and give freedom to the states on how they want to spend their funding. Right now, the bill plans to reduce federal funding to states by $120 billion from 2020 to 2026. As America, this sounds like a good plan because we spend the most on healthcare in the world, but at what cost will the cutting do? They have proposed a block grant system where states will receive a lump sum of money from the federal government, which they can use however they see fit. States will also receive a Medicaid from the federal government on a per capita basis. As you can see, under most states will receive a decrease in federal funds, hitting California and New York the most with cuts. Under this bill, there will also be an elimination of mandates states have to follow. These include the individual and employer mandates. Currently, the individual mandate requires Americans to have health care coverage or pay a fine, and the employer mandate requires larger companies to offer an affordable coverage to their employees, both of which will be eliminated under the federal level. States will also be given the freedom to decide what kinds of services qualify as essential health benefits. Overall, the Graham-Cassidy bill looks like a great way to help lower our national health expenditure and give the states freedom to spend their funding. However, these cuts could put many Americans at risk for losing their insurance.
Is healthcare a right or is it a privilege? We believe it is a right. However, universal healthcare does not need to take the form of Bernie's Medicare for All proposal. Our focus needs to be on cutting costs and ensuring more individuals, not creating an entirely new system. Medicare for All would increase the future expenditures with the risk of a decline in service quality, and the Graham-Cassidy bill would leave millions more uninsured. These aren't optimal solutions, so where does that leave us? Well, somewhere in the middle, which is where we already are. The Affordable Care Act was well-intentioned. It clearly made some blatant errors in its estimates as it was supposed to reduce costs, but it was also supposed to insure more individuals. It was successful in extending coverage to approximately 17 million Americans, and the remaining 28 million uninsured can follow suit without too much trouble. States did not expand Medicaid like the Fed had expected. Our plan will force them to expand that coverage. We do not need to change the structure of how Medicaid is funded, except the federal government will offer more aid. The downfall is an immediate increase in spending. Yes, our healthcare system is going to be the most expensive system per capita in the world. It is time to face reality. But it has the potential to offer the best services because we truly do have the best technology and research and development. And for that, we must be willing to pay an additional price. With that said, we do have some solutions that will reduce these costs significantly.
So how can we pay for the exorbitant costs of healthcare? Here's an idea. More additional Medicare taxes proportionate for wealthier individuals. There's already a 0.9% increase on the payroll tax for people with net income above certain levels. In the US, there are about 3 million people who are classified as high net worth individuals. They have more than $1 million in assets. About 70,000 of them are ultra high net worth individuals with over $30 million. In 2012 alone, the top 1% of wealthiest Americans had income rise about 20%. While the rest increased only 1%. So here's our proposal. Increase the payroll tax to 5% for high net worth and 7% for ultra high net worth individuals. This would generate a lot of revenue. But there are other ways to reduce costs.
We aren't attempting to revolutionize the healthcare system, but this is because our system is not far off from being excellent. It now comes down to execution. America has among the greatest technology and many of the most skilled surgeons in the world, but it needs to become more efficient and cost effective. We believe a lot of resources can be saved by taking a closer look. A report from the American Medical Colleges estimate a shortage of doctors ranging between 34 and 88,000 by 2025. That's staggering. Basic economic principles would explain the shortages directly impact costs. We can lower service costs by focusing on increasing the supply of doctors. Well, we can fix this number of ways. Reduce medical school costs, increase class sizes, and make the requirements less stringent. We have to trust our respected medical schools to produce more quality doctors. While we're on the subject of doctors, we need to reduce or eliminate the $55 billion malpractice industry. $45 billion a year is spent on defensive medicine. Much of it is sparked by fear of lawsuits. And the number of doctors rises Their incomes may decrease slightly, but we can incentivize doctors by reducing their upfront costs and reducing the liability risk by shifting it to the government. We must work together to build a more trustworthy culture. One thing we thought was a big issue in our healthcare system is the amount of information problems in regard to how and where people can receive appropriate treatment. We thought that having an online class that would be required by Medicaid could help. This class would educate people on how they should use different care providers and tips on how to maintain a healthy lifestyle. Misuse of care would go down and in turn help decrease Medicaid costs. More transparency from the insurance companies could also help. The healthcare industry would benefit from making the policyholders more aware so the entire industry is more efficient and held accountable.
So far, we have discussed many ways to improve financing healthcare. There are many other ideas out there, but we don't have time to address them all. Our proposals involve small changes to existing systems. In the end, will any of this stuff actually happen? Who knows? Problems such as obesity, car accidents, adolescent pregnancies, and homicides are not easily solved by tax reform, policy changes, or insurance. What Americans really need is a healthier lifestyle. Eating healthy foods, sleeping, exercising, and all that stuff. When we as a culture recognize the importance of caring for one another, that's when real change happens. I'm sure we could all do a bit more to make America healthy again.